Gynecologist answers for infrequent or irregular cycles. If you have infrequent or irregular cycles, you may have PCOS. Just what is polycystic ovary syndrome? In the 1950s, a pair of gynecologist doctors noted that a metabolic and endocrine phenomenon occurred in a group of women with certain characteristics. These women had irregular and infrequent menses, obesity, infertility, diabetes, cardiovascular disease, hypertension, and polycystic appearing ovaries. It is estimated that nearly 10% of all women of all nationalities and races have this syndrome. The basis of this is an endocrine disorder in which there is an imbalance of estrogen and testosterone. Men have a lot of testosterone and minimal estrogen, while women generally have a lot of estrogen and minimal testosterone. In women with PCOS, there is an excess production of testosterone, which causes male-like characteristics to occur. This leads to increased muscle mass, obesity, hypertension, diabetes, excess hair growth, male pattern baldness, hyperlipidemia, deepening of the voice, acne, and increased risk of cardiovascular disease. How your gynecologist can find PCOS. PCOS is a diagnosis of exclusion. In other words, there is no specific test that a gynecologist can use to diagnose PCOS specifically. Rather, it is based almost exclusively on medical history and physical exams. The one absolute requirement is to have less than normal frequency of your menstrual cycle. Most women with PCOS start as teenagers with fewer than normal periods. If you have had less than 10 cycles in a year, you likely have at least some degree of PCOS. Infrequent menses is by far the most important aspect of diagnosis, but other tests might include estrogen level, testosterone level, insulin levels, and an ultrasound. Treatments. Treatment is usually divided, at least by Dr. Saunders, into two paths depending on whether or not you are trying to conceive. There are some methods that should not be tried if you are pregnant. If you do not want to conceive, then most women benefit from treatment with oral contraceptives. Dr. Saunders prefers to use Yasmin, or Yaz, which helps block the effects of testosterone. Spironolactone is a potassium-sparing diuretic that helps to excrete testosterone and may also be used. Neither of these methods should be used in pregnancy. On the other hand, if you are wanting to conceive, then clomiphene citrate or other ovulation-inducing drugs are used to help increase the likelihood of conception. In addition, most gynecologists will prescribe one of 3 diabetic medications to help normalize your cycle. They all help with insulin sensitization and may be used to decrease your risk of diabetes during pregnancy. I personally prefer metformin. The last and most beneficial treatment, whether or not you are trying to conceive, is weight loss. Losing just 5 to 10% of your body weight can significantly improve your chance of conception and will certainly decrease your risk of diabetes, heart disease, hypertension, and improve your overall health. Weight loss also lowers insulin and therefore the overall production of testosterone in the ovaries. In summary, if you have had fewer than normal periods, you may have PCOS. The good news is that with proper medical treatment, the vast majority of women can still have a baby. For more gynecologist information on PCOS or other women's health matters, visit www.drsaundersobgyn.com or simply call Dr. Saunders at 801-692-1429.